What's up, guys? I want to make this video in regards to GERD or acid reflux. Okay, so what that means is acid reflux is your stomach, it produces acid naturally, but you have this little valve on the bottom of your esophagus. I think it's called the LES or ELS, something like that. So it opens and closes, but sometimes this valve, it gets really it gets weak, or sometimes people have a hiatal hernia, so that valve can't close all the way, so it stays a little bit open, and then your stomach's always producing stomach acid. So that stomach acid, it keeps on going up, and then it goes up to your esophagus, and then your throat gets irritated, and it can cause all kinds of stuff. Irritated throat, hoarseness of voice, you have a consistent cough, always trying to clear your throat out. Um, Sometimes it feels like your throat's closing. Throat closing. What else? Sometimes it got so bad to the point like you don't even you don't even want to eat, or you get kind of scared to eat because of you're kind of afraid of what's gonna happen with the acid reflux. So that's what I've been dealing with since I think it really started to become like really relevant or like noticeable in December. I think early December or November time. I had an episode one day at work, or I was talking to an employee, and I kind of had shortness of breath that day. That's when I was vaping a lot, and I had shortness of breath, and I was talking to an employee, and yeah, I just felt shortness of breath. I couldn't catch my breath. My hands were sweating. I just didn't feel like myself. So I had to sit down. I had to calm myself down. I went to the emergency room, and I think at the time they said it was an anxiety attack or something where along to that line. So yeah, ever since that day, I haven't felt like that. You know, I'm really glad I haven't felt like that, because that was a really bad experience. I thought I was having a heart attack or something. Like I said, it was just like a pain in my chest. It was hard for me to breathe. My hands were sweating. I don't know, maybe it was an anxiety attack. I'm not too sure. But moving down along that line, I think 2 days afterwards, I went to the emergency room again because I had the same thing where it was hard for me to breathe. My hands weren't sweating that one time, but it was hard for me to breathe. A pain in my chest. I was coughing a lot, and I didn't know what it was. And I think they said at the time it was, they diagnosed it as asthma. Okay, so I'm like, all right, I have asthma. So they gave me an inhaler and all this jazz, right? So I kept on having symptoms. They gave me an asthma pump, but I had asthma. It wasn't asthma. So I think 2 weeks after that, I went back to the emergency room, and they ran some tests. They did a EKG. That stuff where they put that liquid dye in your blood, I guess, to see if you have any like blocked arteries and all that. I didn't have that. They checked my blood. Everything was fine. And I think somebody told me, one of the nurses said, oh, you might have acid reflux. I'm like, what's that? And I looked it up online, and all the symptoms that I was having, yeah, it came out to be like acid reflux. And yeah, I've just been dealing with that ever since. I've tried Tums. It works, but um, you start having symptoms again after like 3 to 4 hours. And then like stuff too, when I would take Tums, like, okay, I'll be good for that time, and then after like those 3 or 4 hours, I would feel even worse. It's because what that Tums does, it lowers your acid in your stomach, so it lowers it. And then sometimes when it's too low, you get even worse symptoms. Like you start producing a lot more gas, you burping a lot, and then you get that silent reflux where it goes up and you don't even know it's coming up, and it just irritates your throat. So what the biggest issue with me is, I don't really care about the gas, burping. It doesn't bother me. It's just when it gets to my throat and like, oh, it just feels like I have a sore throat. I always gotta clear it out. I'm always having like cough drops. So I'm not always like I was in the beginning, but at least have like, at least every day like 4 or 5 cough drops. It helps me out, but then it doesn't. It's I kind of mind fuck myself into thinking like, oh, I got a sore throat, like let me pop this and it's gonna help me out, but it doesn't. It uh it cools off my throat, kind of like smoking like a cigarette when I used to smoke back then. It gives me that feeling. Well, I'll have one right now since we're on that subject. This is a menthol one, so I'll have one right now. Like I said, it just gives me that cool feeling, that mentholness. So yeah, like I said, just primarily with my throat. It just feels dry, like I gotta clear it out. I always have like a sore throat. I gotta clear it out. That's the main thing I don't like. Another symptom I have. I'm gonna tell you my symptoms: gas, burping a lot, um, hoarseness of voice, feeling I have a sore throat. Sometimes it feels like my throat's closing. What else? What else? Sometimes I get a pain in my chest, like tightness, not really like it was in the beginning. So what I know now is if you start coughing a lot, like actually coughing, it's gonna make your throat worse. The irritation of you forcefully forcing out that cough is gonna make your throat worse, and it's gonna create a lot of irritation, and it's gonna make your throat close, and it's gonna lead into worse symptoms. So I try not to cough. Sometimes I will, and I try to like not make it so forcefully so it doesn't irritate my throat. Just like a little cough. Like I'll do a demonstration. Like, like that. See, now that I'm doing it, it's I want to keep coughing, so I gotta relax on that. So he also told me I have H. pylori. H. pylori it's a bacteria in your stomach. They said you get it from being in contact with a person that's infected. It can be passed on like through contaminated food, saliva. I don't know. I don't know how I got this thing. Anyways, they said I had it for a long time, so I don't know. I don't know where I got it from. So maybe it was undercooked food. I'm assuming it's that. Or they say 50% of society, I guess in the United States, has this. So you could, when you kiss somebody, I don't know. I don't know. Undercooked food. It could be one of those different reasons. So they put me on this little cocktail stuff. It was amoxicillin, omeprazole, and some other name of some pill. It's to kill a bacteria. I had to be on that for 2 weeks, and I was on that for 2 weeks, and man, I was doing good. But I think it was omeprazole that was making me feel so good because it's an antacid. It's something for your esophagus where it heals it. And man, I was feeling really good. I didn't have no symptoms at all. And even when I stopped taking it too, for a week after, I was good. I'm like, oh yeah, you know what? It was this H. pylori. I have that. And I thought it went away, and no, it didn't. But here's another thing though. I took that H. pylori test at the doctor, and they said that. Well, I was talking to the nurse guy, and he's like, "Yeah, I had to get treated 3 times for it because he had it so bad." So I'm like, "Oh man, like I might still might have it even though I got treated. So I took that test and I got to get a follow-up interview with the doctor, I think next week, or I called up this Chinese lady and I didn't really understand her because the way she was talking, I couldn't really understand her. So I'm going to call up on Monday and see whether I can make an appointment that week, or she said I have an appointment May 5th. But I'm like, I didn't even make an appointment in May. Like, that didn't make sense. So I'm just going to call them up and see if I actually have an appointment on May 5th or if I can make one that week so they could tell me the results. I got the H. pylori test on Wednesday or Thursday. So I'm assuming they got to take it to the lab, put it into a machine to see if the breath or whatever it is inside the bag has the H. pylori stuff in it. I don't know, gas. I'm not too sure. I don't know. I don't know what kind of test they run, but yeah. So I'm gonna see. Hopefully it's H. pylori. I'm praying it's H. pylori still. Like, maybe I have to do 2 or 3 treatments like that guy did, and I'll be done. I'll be happy with that. I don't want it to be acid reflux, but if it is what it is, they have surgeries for this, and I'm thinking about taking that route because this thing sucks. Yeah, this thing sucks. It messes up with my everyday life. I notice my triggers for the acid reflux, caffeine, coffee for sure. I start burping a lot. I feel like my throat getting sore. Soda, chocolate, kinda. I ate a couple of Reese's at work. Some people have it at their desk, and I'll snag one really quick and I'll eat it. And then like 10 minutes later, my throat starts feeling a little weird, and I start coughing. I'm like, oh my God, man. So you can't have carbonated drinks, chocolate, peppermint, greasy foods, caffeine, alcohol. The alcohol, it doesn't do anything for me. I noticed that. It's opposite. It's opposite for me. With alcohol, I don't I don't burp. I don't have to clear my throat or nothing like that. Like I'm good when I drink alcohol, but the next day is like when you start drinking and then obviously you get a hangover, you get the beer shits. I don't know if you guys ever get the beer shits, but I do. When I drink like 2 or 3 beers, even right now I drink 2 or 3 beers. I'm not saying I'm drinking, but if I were to have 2 or 3 beers, the next day when I wake up in the morning, I gotta take a shit. And it's like that beer like shit, like the diarrhea, and like, oh man, my stomach hurts. Like, you kind of regret drinking. Every time now I drink, I regret it, but what could I do? Yeah, I don't smoke anymore. I'll smoke sometimes, once in a while. Like I'll hit the vape pen from my cousin or something, or I didn't really feel the urge to cough or anything like that, but yeah, like I'll smoke sometimes, once in a great while. But alcohol, yeah, it doesn't do anything for my acid reflux. So yeah, they have a couple options where they put some surgery where they cut you open right here. They overlap a portion of your stomach and they tie it around your esophagus to make it tight again. Like I said in the beginning, your ELS is a little it's like a little tube like this. It gets loose and all that stuff, so that's why the gas is going up from my to my esophagus. I've seen that. They did that. They have that procedure. They have some other one where they put like this little circular band, like with magnets. It opens and closes, so when the food passes through it, it opens, and then as soon as it's done passing through, it closes, so it keeps it tight so the acid won't go up to your esophagus. What else? I think they have some other one where they put something down your throat, right? And it goes all the way down to your ELS, and it burns it a little bit, so like it gets tighter. I'm kind of leaning more towards that option. I don't know if I want to have like a little elastic band or like magnets, like just, or a scar right there. Obviously, like I have a scar all over my body, so I don't really care anymore for a scar under my hand too. So I'm all fucked up. But we'll see how it goes. Take care of this. You have to take care of this acid reflux, because if it keeps on damaging your esophagus, it could lead to scarring, and you can get cancer. You can get cancer. I took I think they called it an endoscopy or endoscopic, where they put a camera down my throat, and they said I have scarring. So that could be from the acid reflux or cigarettes. I don't know. I used to smoke. I never really was a big smoker. Like, I would smoke. Like, when I was younger, I would smoke every day for like probably like a year. I wouldn't smoke a pack a day, maybe like 3 or 4, probably like 5 cigarettes a day or 4 cigarettes a day. But yeah, over time, I stopped. I would smoke. I'll stop. I'll smoke. I'll stop. Like, yeah. Usually when I get the urge to smoke is when I'm drinking. When I'm drinking, I get the urge to smoke. When I see people, or just you want to get that little buzz going, while you're drinking. Obviously, when I drink, it leads to bad things. I should say that. I want to start doing bad things, substance wise, I guess you can say. But good thing I haven't, I haven't. But when I drink, that part of my mind comes out, and it just, I guess it just wants to feel something else. But I think that's always going to be part of me, though. It's I come to the fact that it's who I am, which isn't a bad thing. I know how to control myself. I've been in plenty of situations where I've been around drugs, and I've said no. So I've had said yes a couple of times, but like I said, it was drinking. When I'm sober, it's I don't really get the urge. I think about it. I think about it, but when I'm drinking or when I'm drunk is when I'll take the initiative to do it. It's that boundary, it goes away when I'm drinking. So yeah, but it is what it is, I don't really think it's a big issue in my book. I've always had stuff like that under control, versus other people that I know that they can't control that stuff. They get the urge and they got to keep on going and going and going. That's never been me. It's never been me. Thank God. Okay, well, that's all I have to say about acid reflux. If you have any questions about acid reflux, uh, send me a message or write it in the comments. Whatever. I try to answer or give you the best advice that I have regarding acid reflux. All right, guys, take care of yourself.